Please take a look at this patient. She is 30 years old. When I look at her, I notice the presence of tiredness as well as sadness. Can you zoom in, please, more? When I look, straight gaze, observe that when she tilts down and I position my finger, I notice that the nasolabial fold improves when I create the lateral pulling. So glasses, look. Step number one that we have to proceed is with the marking. I like the patient, I ask the patient to look up and I mark the transition of the lower eyelid with the cheek. I mark this with both sides. Then remembering, I also mark L2. L2 is a no-go zone. I cannot inject L2 because she presents already a very important projection at the eminence of the zygomatic bone. So when I mark L2 that I cannot inject at it, I have to proceed and find L1. I feel the suture right, then I create an anterior point and a posterior point. So in these 3 points, this is where I'm gonna anchor the cheek to improve the nasolabial fold. Let's go back and assess. These are the 3 points that we discussed before, and in each of these, I will inject 0.1 of Juvederm Ultra Plus. Okay, let's clean. Ihalji, here. I want to see Ihalji. Then look, I get Juvederm Ultra Plus with prime, look. We see the bubble, but we don't touch it, look. Clean again, all the time. Then I pinch and retract the skin, look. I enter where the black dot was. Touch the bone, I aspirate, and I inject 0.1 in each point. Look. Zero 1 in each point. Totalizing 0.45 in my CRH. There was a change in the position of the dotted line. And if you all see, she looks slimmer already on the treated side. Observe what happened with her masseter area. I notice a change. Okay, we see a difference in the dotted line, and also we notice that she's already getting slimmer. Ask her to close her eyes. When she closes her eyes, I can see better and better what happens. So I will tilt her down, look. Take a look. By injecting L1, I already noticed the change in the nasolabial fold, and also I noticed the change in the facial shape. Her eyebrow looks slightly higher. Look at the camera now. Ask her to smile. 笑，大笑. Take a look also, her nasolabial fold on the treated side looks less visible. Okay? Smile again. After injecting L1, ask her to straight gaze. I mark L8. So we mark the inferior border of the zygomatic arch. I ask her to bite. I feel the anterior margin. 放松. Then I tilt down to observe the shadow. In this area is named after L8. And in L8, because it's a big area, I will change 2 cannulas with Juvederm Ultra Plus. Can you ask her to slide a little bit? Okay, so this big area we have to clean, look. Clean very much, look. I pinch the skin, strong. Then I enter with a 23 gauge needle. I make a round movement to open the orifice. My assistant takes out for me, and I enter with a 25 gauge cannula. It's very important to use the 25 gauge cannula because it's the good measurement for us. This area, it's normal to hear some retractions on the skin because this area can be very attached to deeper planes. So fanning very slowly, take a look so that the patients, they do not suffer from any discomfort. I will position a total of 0.8, a full syringe of Juvederm Ultra Plus. After injecting full syringe, we have to massage L8, look, to make it uniform. So after injecting L8, let us observe what happened to our patients. Look at the camera. I don't know if you notice, the more I put product, she's looking slimmer and slimmer. Now I would like to show to you, Fanson, when she close her eyes and she tilts down. Close her eyes. Also take a look. The more I inject the lateral vectors, which is L1 and L8, take a look how the shape of her face looks smaller. You see that her cheek now is in a higher position, look. So that's why when we position L1 and L8, we also improve the nasolabial folds, but we treat sagginess and we change the patient shape. Look at the camera now. The next injection site is going to be L3 with needle. So then I look, mark the mid-pupillary line, then we find the foramen. So between the mid-pupillary line and the no-go zone, I mark L3. But L3 is a tricky area for us to inject. So I will lie down, take a look. I will show you the hand positions that I would like you to do the same. But first I will remove the mark so that we don't contaminate. I have in my hand a syringe with 0.5 that I injected initially in L1. So look, I ask her to chin up, I clean. With my middle finger, I protect the foramen. With the second, I protect the orbit. And with the thumb, I lift, look. This is very important so that you should imitate. Enter with the needle, touch the bone, aspirate, and we inject 0.3 in L3. very slowly so that the patient does not feel any discomfort. So, I have here 0.2 left. But let's see before what has happened after injecting L3. Sit up. So L3 gives us even better support, and the more I'm injecting, we see that she's becoming slimmer and slimmer. Now, 现在大笑. Take a look. Beautiful, with a very important improvement into her nasolabial fold. Fanson? We have to stop a little bit the bleeding before continuing. So let's see what has happened with the area of NO1. I'm going to inject deep to the bone. I have to clean first. Then I have a syringe with 0.2. I tell the patient, 在这里动一点一点. Touch the bone, aspirate, and I inject slowly. Okay, a full syringe is now over. This is an area that may bleed, so we stop the bleeding. Can you zoom in now, Ihalji? Zoom in to her nose. I don't know if you notice, by injecting NL1, we changed the position of the nasal flare. If you compare the treated side with the non-treated side, take a look that by treating NL1 deep to the bone, we change positions of the nasal flare. And I would like her lying down to 笑,大笑. Take a look that on the treated side, the nasal flare widens less, it's narrower, closer to the midline. Fanson. Then, let's sit her up. Now take a look and observe. Can you zoom in, please, more to her nose? Take a look that the width, the widening of the nasal flare, if you look, this distance looks narrower. And take a look also her upper eyelid. You see her upper eyelid changed. This looks sad and this looks more energetic. Now she also looks slimmer. I want to ask her to smile. 笑. Take a look that she looks less heavy, and take a look her eye bags. Now it's the time for us to go to the L3 Fanson with Juvederm Ultra. I have to fill all this area, that is the mid-cheek area, look. And with this, I will fill and inject a total of 0.4 of Juvederm Ultra, and this area is sensitive. So I'll ask her to close her eyes. 在这里一点一点动. Okay, look, clean. Then we enter with the needle, make a round movement, look. That's all. And I have half a syringe to be injected in her L3. Very slowly, because this can be painful. Okay, have a syringe. So after injecting L3, we have to massage. Every time that we fan, we have to massage, look. And finally, I will inject NL1, NL2, NL3 with Ultra 4 refinements. But before, I have to wait a little bit. Okay, look. Let's see the changes time by time. Take a look at the change of her facial shape. She's looking more and more beautiful. Can you see the change in the facial shape? So, can you see the change in her facial shape? Okay, good. Now, let's ask her to smile. Xia. Also, take a look. Changing, getting a more beautiful smile. Fanson. Now, I will inject Fanson, with a cannula with NO1, NO2, NO3. I have 0.4 in my syringe. Trying to improve. Very slowly. With 0.2 in NO1, 0.1 in NO2, and 0.1 in NO3. This will help a lot the nasolabial folds. So after injecting, but please observe the change in the position of the nasolabial folds and also the nasal flare. Okay, let's see the difference now with one side with the other one. Take a look. Can you tell in Shanghai and also here, if you notice that she looks slimmer? Now ask her to close her eyes. Take a look when she tilts down. Do you see a difference in her facial shape when she's tilting down? Is she less saggy? Yes or no? Raise your hands. Next. Do you see the difference in her nasolabial fold? Yes or no? Now, do you see difference in her nasal flare? Good. Now, I also noticed that by injecting the New Age look, we see multiple changes in her face. Now, 现在笑大笑. Take a look at the changes that we have in the position of the cheek. Take a look. Can you zoom in? Fanson. Take a look that even her eye bags, they have improved. Look straight, please. Take a look at this distance that we see in L3, nasolabial fold, and take a look at the other side, how more defined it is. We don't see anymore the concavities that she had presented. Meaning, we can time by time improve only by indirect approach to the nasolabial folds. I'm going to go to the other side and let's review. So first, we mark the zygomatic arch, then I fill the first point, anterior and posterior. Coming down, turn, close her eyes. Ihalji, less here, more here. Okay? Clean. Get a syringe, prime, and can you zoom in more? Zoom in more. Zoom in more, more. Okay, look. Where the black dot was, aspirate and inject 0.1 per point. Look. We inject in the front of the black dots. A total of 0.3 was injected. Then I have already, and I ask her, yeah. I feel here the anterior margin. Then we start cleaning and with a cannula with Ultra Plus in L8. I'm going to give a closer look for you to see more details. Now, Ultra Plus with cannula. Quite bien. Needle first. Look. And so. Round movement. Dry gauze. So, very gently, because this can be a sensitive area. Very gently. Always fanning into the subcutaneous inner weight. Okay, full syringe. Remember that after L8, it's fanning. We need to massage to make the injection uniform. I don't do this in bolus L1, we don't need. After injecting L8, I made the patient to sit up. I changed, open. Then I marked, look, L2, which is the no-go area. I cannot inject here. Then I marked the transition, the mid-pupillary line, identify the foramen, and between the mid-pupillary line and the red mark, I injected 0.3 in L3. As I'm right-handed, this can be more challenging for me. So, enter, cleaning first. Look. I position, chin up. My thumb now in the foramen. My second finger, I protect the orbit. And with my thumb, I retract. Okay? aspirate. And I inject 0.3 in NO3. Very slowly. And having 0.2 left that I will use in NO1. Ascorticina. Tightly don't begin. Cleaning. Get. Did you change the needle? Clean again all the time. Then look. Touch the bone. Aspirate. Injecting very slowly. Don't move the needle. I'm touching the bone. Okay? So after finishing 2 syringes in the left hand side, we proceeded with the marking of L3. Look at me. Look. In the area that we need to give support. Over lower fit. Okay, I know. Go here, please. Let's go. Clean. Close your eyes. Close your eyes. Clean. Enter. Round movement. Very gently. And inject L3. Be careful, we cannot inject in the tear trough. That's why I'm putting my finger to protect. Very slowly, fanning. And I'm injecting under orbicularis oculi in the medial SUF. 0.4. Every time that we fan, we have to massage. Now let's go to last refinement of the nasolabial fold. Do you have saline? Saline or no? A gauze with saline. Get saline. You get somewhere. You. Please. NO2, NO3 with refinement with ultra. This area can be sensitive. Saline with gloves, please. Very slowly, because this can be sensitive to our patients. very gentle. Done. Now we wait. Look. Take a look. You see that this is an immediate result. She's looking much beautiful. Take a look. Very natural look. You see, after injecting 6 syringes, there is no stigma of any treatment. Look. She looks very natural. Give me a beautiful smile. Xiao. Okay, Fanson. Okay, now ask her to look at the mirror. Too late. Look at the mirror. Give a cotton tip for her. Look at here. Where do you see changes? Show me. Ask her to show where she sees changes. Where do you see changes?
The nasal level and the cheek, upper cheek.
What else?
还有吗？什么？
What she liked most?
你最喜欢哪个地方的改变？Apple cheek。
为什么？
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 Looks more energetic.
More energetic. Okay. Now take a look at the chart. Do
看这
you
4个表格，
do you think you look less tired?
你觉得你自己看起来更加没有那么累了吗？
Do you think you look less saggy?
2个都有吗？第2个看起来有没有更加松弛？他一个个问，
Yes or no?
是或者不是？
Yes. Here, yes.
对，
Yes.
对的，
Here,
是吗？
here, and here. 4. What was the biggest change for you?
选一个。
Biggest change. Younger. Point again.
再举
再
一下。
指一下，
Okay. How many years younger? Look at the mirror.
年轻了几
看一下
岁？
镜子，你觉得
Look
自
at
己
her.
年轻了几岁？
Look at her. How many years younger?
现在我实际年龄30岁，然后我感觉我现在应该是至少年轻了3岁左右。
3 years.
3 years. Excellent. Take a look now. We see that this is the area
受你已经
that we immediately after we finish, and then Fanson, no smile,
放松。
and we can go now and proceed.